agency to be part of ASAP, so we welcome everybody. The first item of business is, well, so I introduced myself. Kelly, do you want to introduce yourself?
Sure, Kelly Rodriguez, I coordinate ASAP.
So the two of us will be talking a lot, but we also want to hear from you. But the first item of business is going over minutes. So Missy Coyle is our, we're going to call her like a DJ. She's going to put up the stuff you need to look at.
Let me know if you can see it.
We can see it.
Good.
She'll scroll through. It was also in your reminder about the meeting. So if you have a minute to take a look, and then if there are any edits, this is your time to give me edits, or I will entertain a motion to approve. I feel like we should play music or something here.
Jeopardy music.
You can feel the pressure of reading.
Moving to the second page. Here's our music.
I think you're good to scroll a little bit more, Missy.
Yeah, I was going to say, don't forget to scroll.
I was still reading, sorry. I read it earlier. I was just looking for mistakes. Moving to the third page. We're nearing the end.
There we go. That's the end. All right. Did anybody see any edits that needed to be taken? Missy, if you'll scroll up to the top for those that we had a bunch of people come in a little late, just making sure that if you were here that you're in the attendance record. That's one thing that we see a lot of edits on.
One of the hardest things to do in virtual meetings.
Right. Without an upgraded account, apparently.
Yeah. Listen, I'm working on it.
I know. All right. Can I get a motion to approve minutes since we don't hear any edits?
I approve.
This is
I agree.
Parnia. I approve.
Okay, thank you, Barnea, and then did I hear somebody who was going to second or also?
Well, you heard, I don't know if you heard me say I approve, but I'll second.
Okay, thank you, Bonnie. So we have a motion to approve and a second. Does anybody is anybody a nay? Or need more time? Speak now or forever hold your peace. In the chat box or verbally. All right, so we're gonna say minutes are approved. We had several people come in after we were looking at meeting minutes. So I'm just gonna one more time say that as you come in, you can introduce yourself in the chat box. Eventually, we will copy and paste everything that was in here so you can see people that introduced themselves before. It's great to see some people that I recognize and others that are newer. So we, at the end of the meeting, the last agenda item is always a roundtable, and that's when we do updates from everybody that wants to talk. All right, so we're gonna move into the second part of the agenda, which is our guest speaker. And today we have Groups Recover Together, and Whitney Hewson is going to speak. So I'm going to turn the floor over to Whitney.
Hello. So as you guys can see, I'm in my car, and in true COVID-19 fashion, you know, if there's one thing we've all learned, it's adaptability. So here I am, and I am gonna present from my car. So you guys, I hope you get a lot from this. I really love what I do, and I always, you know, like starting my presentations just kind of acknowledging you know, what we do, and also like what all of us are doing every day to kind of fight the good fight, and just reminding ourselves that this opioid epidemic is really severe, and it's really just paying homage to everybody who puts in so much time and effort to really combat what's going on. And so this crisis is real, and we're really doing everything we can, but I have a lot of respect for everybody in this meeting because each one of you are really doing something good to help this. And it's a lot, you know, it's a lot to take on. It's a lot to experience. And one of the things that I wanted to start off with was just to kind of put a frame of reference for kind of why we do what we do and how important it is. Really quickly, before I go into this slide, I just want to think about if a plane was crashing every day, how we would feel about that. If a plane crashed every single day of the year, 365 planes a year, how would we feel about that? And the reason why I bring that up is because it is something that most people don't really think about in terms of opioid overdose. But 136 individuals are dying a day. So that's essentially a plane crashing every day from addiction. And it's something that is really important to address. And so I'm really grateful to be in front of you guys, because that's where my passion comes from, is just wanting to help people and wanting people to see people. So but I wanted to start off just briefly with who founded Groups Recover Together. We started in 2014, and I'm just going to read this out to you guys because I think it's really impactful. Who lives and who dies hinges on what healthcare is available and how much it costs. I became a physician because I believe everyone should be able to access the help they need to heal. I was drawn to addiction medicine because structural discrimination and bias have stifled the most effective types of treatment. Drug users have been made to illegal and invisible people, their behavior criminalized and pushed out of sight. I founded Groups Recover Together to bring the best of modern medical science to those most in need. It's my hope, as it is Paul Farmer's, he was the other founder, that the benefits of such treatment may also serve as an antidote to despair. So with that in mind, you can go ahead and go to the next slide. I want to mention what the status quo has always been. And the reason why that's important is exactly what he was just talking about, which is how do people get help? How does this work? You know, what do people do and in order to recover from opioid addiction? And right now, there's a status quo model of kind of like there's a provider, and that provider gives a script, and they spend about 15 minutes with somebody, and that prescription is for about 30 days. That prescriber may or may not have any counseling background. They may or may not connect the person with social supports. And then your analysis is also used as more of a tool for billing than it is for a tool in treatment, which is really what it's intended to be. It's just kind of a tool, not a punitive device in which we can kind of hold people down. So in groups recover together. How we've changed this model is we're an outpatient opioid addiction treatment center. And I say that first and foremost because I think people confuse us and what we do with other types of models, such as like a methadone clinic or that kind of thing. We're a little bit different. So next slide, please. The 3-pillar model that we use is based on medication, therapy, and care navigation. And our members are going to meet with our provider for an hour a month at least, and they also are going to get a 7-day prescription of Suboxone. So something to know about Suboxone that's really interesting if you don't know what it is, I'll do a little brief education because I find sometimes it's helpful depending on who knows what drugs. So buprenorphine is Suboxone. There's also another label called Subutex. So Suboxone is actually Suboxone and naloxone together. So it's really buprenorphine and Narcan in the same medication. And Subutex is just buprenorphine. So what does that mean? That means that if you crushed or tried to shoot or snort or do anything other than put the sublingual film or pill under your tongue, that releases the Narcan and then prevents overdose. It also prevents any kind of high, so it's a diversionary method. And then Subutex is just buprenorphine. So that medication you can take multiple of, or you could crush it or whatever you want. And that's the difference. The nice thing about buprenorphine that's different from methadone, for example, is that it's a partial agonist, which means there's a ceiling effect. So you're always going to hit a ceiling and you're never going to be able to feel more than that ceiling. So that's the nice thing about buprenorphine, because it's a partial agonist. So it only fills part of the receptors in your brain. It doesn't fill all of them. Methadone is a full agonist, just like an opioid is, and that means it covers all of the receptors. So a full agonist, there's no ceiling effect there, so you can take more and more with a more and more of an effect, if that makes sense. So I like to mention those two, just the differences, because some people are like, well, why Suboxone? So I like to explain that a little bit. And also it's nice to know, because that way you can make informed decisions whenever you're, helping somebody, or, God forbid, a family member or something needs help, then you can kind of know some of these things. So we also do some diversionary precautions, which I'll talk about a little bit later. But the second pillar of our model is therapy, and that's a huge one, because group therapy is so important, especially in addiction. The great thing about our groups, it's once a week, 1 hour a week, and why that's important is because people in addiction really need that group therapy. They need others around them so they do not feel alone. They do not feel isolated, so that they can understand some more pro-social behaviors, so they can kind of get in the swing of feeling like they're a human being again. And in this group therapy session, because everybody's going through the same thing, it's really great, because then what happens is there's a sense of understanding, a sense of family, a sense of connection that starts to happen after a while. Our groups are pretty small, so it's like 10 to 15 people, and it's with the same group every single week and the same therapist. So after a while, there's a comfort level there. They start holding each other accountable. It's actually pretty cool to hear and to watch them. I was talking to one of our office managers the other day, and I said, so what do you think about our group sessions? And she said, oh my gosh, they're amazing. She was like, actually, the other day, I had to turn my my video off. And I'm like, why? She's like, because I was crying because of how much this person had been through and how they were getting help from other members. And she was like, it was just so beautiful. I just started crying. And I was like, wow, that's amazing. And that's what we're here to provide, is that really safe environment for people to feel no judgment and to feel that ability to be able to share what they need to share in that group therapy setting. They can also opt into individual and family therapy as necessary. And then the third pillar is something that's really important to us, and it really sets us apart, because care navigation is more than just case management. Our care navigators are there, honestly, pretty much 24/7 for our members. They're there to help with anything from food stamps to Medicaid to, employment, housing, any of those other, social determinants that they might need help with, to be able to get their life in that place where they need it to be. Excuse me, but also just as a support, somebody to check in with. They also, for example, I don't know if I told you guys this already. I've told some people, I don't know who I've told, but it just stuck with me. That's why I keep saying it, because not long ago, we had those big snowstorms up north, right? And one of our members was in Boston and totally got snowed in, and us Floridians, we do not know what to do with snow. So she was straight up terrified. So she was like, oh my gosh, what do I do? So what does she do? She calls our care navigator, and our care navigator was able to walk her through that. And I think that's really special, because not often do you have, a member or client who calls you in their time of crisis. And so our member actually felt that comfortability to call the care navigator, which was pretty awesome. All right, next slide. The next slide that you'll see is actually just a little bit, I like to show just our providers. We have licensed counselors. Everybody specializes in addiction. We have care navigators, peer support, but also our office manager. I don't know if any of you guys have ever been an office manager, or maybe you are now, but if I find the title to not be accurate, right? Because that person is so much more than an office manager, at least in our offices. Again, to kind of provide those wraparound services, that wraparound care, that pretty much no matter where our members turn, they're going to get the help that they need. And that office manager is that smiling face when they come in, that compassionate ear when they're on the phone. It's, we have a text app where they're able to text with the members, which the members absolutely love, because they can reach out at different times and if they need something. So we have all of that kind of team-based care that we work with our members. And it works out really well, because the members feel like they have a lot of support behind them. And on the next slide, you will see, sorry, my throat is like really dry. This is our member journey. So our member journey is something that's all important, because as soon as somebody asks for help, and you guys have seen this, right?
Think so?
I think we lost her.
Did we lose her completely?
I think so. Let's just wait and see if she comes back on.
Okay.
Can you guys hear me?
Yes,
Okay. Did you lose me for a second?
we
Yeah.
did.
Okay, I'm back. Gotta love technology. All right, so what I was saying was that this is our member journey, and when someone asks for help, oftentimes you don't have, 2 weeks or 3 days. You have about 24 hours to try and get somebody in and help. And so referral line is day or night, and the reason that is so important is because if someone decides o'clock in the morning they really need help, they can call that crisis line, and it's staffed by crisis certified counselors, so it's not just a call center. So that's really important too, because again, you guys see it also. It's people suffering with addiction. They are struggling. So they need that ear, that somebody to listen and somebody to understand what they're going through, and also to hear, like maybe they need to call 911. Maybe they need to be Marchman Act or Baker Acted. Maybe there's some.
We lost you again, Whitney. She disappears from where I can see her.
Yeah, I'm looking too.
Okay, I don't know why it's doing that.
If you turn off your
Can you hear
video,
me?
sometimes it works better for us to hear you.
Okay, let's try that.
Yeah,
That does
Is
work.
that better?
yeah.
Fantastic. All right. And if necessary, I can always call in as well. So after they, are on that crisis line, then they're able to get an intake with the counselor within 24 hours. Here in Florida, it's very, very quick. After they're able to get in for that biopsychosocial with that initial intake counselor, we're able to get them into the prescriber usually the same day or the next morning. And that's important because if an addict starts feeling sick, what do we think is going to happen? It's a dangerous time. So we want to make sure that we're able to get them in so that they don't start feeling sick and that we're able to help prevent those cravings right away. And then within that first week, they're going to pick the group that works their schedule. And then of course we have ongoing recovery support for them. The next slide just shows care right now during the pandemic. We're probably going to continue to maintain that.
Are we ready to switch?
Yeah, you could switch.
Okay. It cut out, so I wasn't sure.
That's okay.
Wait, it's
Yes.
not changing now. 1 second. So sorry.
That's
There we
okay.
go.
These are the joys of COVID, right? So this is just showing again that we're doing that virtual care, e-prescribing. We've got HIPAA compliant virtual therapy, and actually we've found our members actually have responded quite well during this to virtual services, more better than we really thought that they would, to be honest. And our attendance has gone up. I mean, some of the barriers that people experience when they're trying to get help, again, can be transportation. So it's really it's a great thing to see. Okay, you can go to the next slide. This is something that I think is really important to show. We actually track outcomes, and it's very important to us to know these outcomes. So for groups, we track attendance, abstinence from opioids, and retention at 6 months. And as you can see, it's quite high against the industry standards. And what this means is that our patients really, they enjoy coming to therapy, and that they maintain that. And they retain that, they continue on, and also that they're able to remain abstinent while they're on the Suboxone, that it's helping them with their abstinence. And it's really important also to note that if somebody were to test positive in one of our drug screens, if they were, again, they tested positive for something, we are not going to kick them out of the program. That's one of, I think, the biggest faults in some of these treatment centers. Addicts are going to struggle. People that are suffering with opioid use disorder, substance use disorder, it's taken a long time to get here. And for us to kind of snap a finger and expect everything to turn around or to be better is maybe a little unrealistic. So in our program, when people test positive, it's about a conversation. And when that happens, what we've noticed is that our members actually come to us. They don't wait for the drug screen. They say, hey, I messed up this weekend. I just don't know what to do. I don't know what I'm doing wrong. How can you help me? And that's where the conversation and the real magic really starts to happen. So that's really important to us. Also, if they, for some reason, do not attend group, we do have a makeup session. But if they don't attend group, then we do rescind their prescription, because we're not just going to prescribe irresponsibly. We want them to be engaged in treatment. So that's really important to us. So barring, a death in the family or something really massive, typically speaking, they have to be into that makeup group in order to get that prescription. And again, that helps them remain that consistency throughout the time that they're with us. They're with us 18 to 24 months. And they can taper at any time during that 18 to 24 months. We walk them through that. We talk them how, what's the best timing for that. And so we want to help them with that as well. And the next slide is talking just a little bit about the precautions we take for abuse and diversion. So we do that 7-day prescription instead of the 30-day prescription. And we're with them every week. So we see them, we notice if they're not doing well. And so that's a big part of it as well. That urine drug screening, we are able to do that, make sure that they have the medication in their system. We do random pill counts, and we check the prescription drug monitoring program. And they also have a pharmacy home, meaning it needs to be a pharmacy near their house. And they have to go to that same pharmacy. They can't just shop around to different, pharmacies and just pop all over the place. They have to keep that same pharmacy. So that's really important as well. One thing I did want to highlight as well, if you want to go to the next slide for me, is that we do a lot with emergency departments. We really want to work closely with the community, because that is the only way that we are all going to make an impact, is if we work together. And we do things like this. I just liked it as an example where we're able to help with the discharge planning out of an ED or crisis stabilization might be. And we're able to also help and consult and do strategic support when an ED wants to actually start induction for buprenorphine, meaning they would like to start the induction in the emergency room before the person even leaves. So let's say somebody gets Narcan on the street, law enforcement or EMS take them into the ED, and then really what happens from there is what matters, right? So now they're starting to feel really bad because now they're in full withdrawal. And now what happens? So if they can induct them on that buprenorphine and then hand them off to a provider such as ourselves, then that's where they're able to really help people not get stuck in that cycle where they're just, back later on that night again with an overdose. Really, really important. Next slide. This one is again showing how all of it, we're actually in, I don't think I mentioned this, 6 other states, and we've got about 7,000 members total, right? So we're new to Florida. Our first open location is been in Orange Park up in Jacksonville. And then next we are opening, hopefully this week, the office is open. We're waiting for our DCF licensure in Ocala. And then it'll be Bradenton, and then I think it'll be Newport Richey. So that's kind of where we're going, is down that coastline. But we're in each community, the goal is to absolutely be a part of that community. Like, I came to this meeting last month. I attended the opioid town hall you guys had, which was amazing. I absolutely loved that. I just was floored at how, again, when we're all working together, just beautiful things happen. So it is truly our goal to partner with the community in all aspects in any way we can help, whether it means doing a presentation on harm reduction or doing a presentation on, medication assisted treatment or whatever that looks like. However we can help work together with our community to make this a better situation. That's what we're here for, to help save lives and to help people get that access to care. You can go to the next slide. This one is just kind of a reminder that we have that 24/7 access to the intake. We've never had a wait list, which is really exciting because I know that you guys have experienced that. I know that in the previous treatment center I worked at, there's a very long wait list. So it's really important to us that we never have a wait list. And then also, again, to that partnership point, we really make sure that there are lots of touch points with our partners and that we are really, again, working together to help our members, to collaborate, to give our members the best chance at recovery possible, and, their family members. So that sometimes can look like, okay, I decided to get help, but now my husband needs help, and my kids are struggling. So maybe is there somebody that you can send them to for therapy? So it's really all about collaboration and working together to help the whole person and also their extended family and family. So it's really important to us to treat our members with respect, with care, with dignity, and bring value to their life. That's really one of our main principles. And also, again, part of why Groups was founded was to be able to give people access to quality care, not just access to any kind of care, but really quality care. Everybody deserves quality care, and it's really important to us. And I just want to end really quickly with 2 testimonials from our members. So you can go to the next slide. This is Caitlin. She's a member in Indiana. And she says, I look forward to groups every single week. Addiction has taken a lot. Recovering this time, I feel completely different than what I was. I'm getting my kids back. I'm working. It's completely turned my life around. And our next slide, excuse me, is Adam. And he actually has a video on our website. If you go onto our site, it's actually really, really inspiring. And Adam says, being able to see other people doing the right thing and their lives changing gave me the hope to see that my life could change too. And this is really the kind of inspiration that we provide to real people. And again, we're here to be a resource to this community, and we're here to help. Right now, we're able to see anybody in the state of Florida because we're completely virtual, and in the future, we'll have some kind of hybrid where some people will still be virtual, but we're opening offices as rapidly as we can, only because the epidemic here is very real. The pandemic has made it that much worse, and it's just really important to us to see that people get the help that they need, and to work within our communities to make that happen. So if you guys have any questions, I'm happy to answer them. Hopefully that made sense and was helpful. And hopefully we didn't cut out too many times for you guys to be able to hear me.
Thank you, Whitney. I think it helped turning the camera off, and other than that, you only had a few glitches, which we call a win
Awesome.
here at ASAP.
Okay,
It could be
I hear
worse.
that.
I logged everyone off last meeting.
Yes. So our bar is set. Does anybody have any questions for Whitney?
So Whitney, you said that right now the brick and mortar location that you guys have available is in Jacksonville, right? And the other ones are up and coming?
Correct.
Okay, that was one of the questions.
Everybody, like I said, everybody's virtual right now. And until the CDC guidelines, are more relaxed, we're really trying to follow those guidelines closely. We just feel like it's still safest to be virtual. But yeah, we'll be open soon, I'm sure.
Awesome, thank you.
This is Patty. I have a question, please.
Go ahead.
Winnie, is it Medicaid that you take, or private insurance, or both?
Great question. So we are just, honestly, we're waiting for our Medicaid number. So that can take a little time. So we're expecting in 30 to 60 days to have that. We've submitted that, about a month or so ago. So for right now, we are cash pay, which I didn't really mention, but it's $65 a week. And that is what I would call like a flat rate. There's no additional cost. So it doesn't matter how many drug screens they have or how many times they meet with a provider or therapist or the care navigator. It's only ever going to be $65 a week for them. Eventually, we'll also have our commercial insurance providers. It's just, again, credentialing. So it just takes a little bit of time to get all those credentialing processes in place, but that'll be soon as well. So eventually, we'll be able to take commercial insurance, Medicaid, and also self-pay.
Great, thank you.
And I noticed, you're welcome. I noticed somebody asked about an age restriction. So we are 18 and above. And so that's also, again, why I love partnering with meetings like this, because I definitely need resources in the community to be able to help people that are under 18, to be able to help people of all different, issues. So for example, if one of our members is experiencing severe mental health, then we need to actually find a provider that can help with them with that. So that's important as well. When we'll be opening? Okay, so I'm not sure, the exact date is not in my head right now, but I can look once I'm done here in a minute, and I can tell you the rough estimate. It should be within the next couple months, though. We'll be open there. Any other questions? great questions. Thank you so much.
Oh, address to brick and mortar.
Got it. It's 2020 Kingsley Avenue, Orange Park, Florida. And if you go on our website, joingroups.com, then you can also see our other locations listed there. Those that we have an address for already. Cool.
Well,
We're
thank you.
we're really excited, honestly. Pasco's been amazing. I mean, everybody has honestly welcomed us with open arms, and I'm truly excited to be there and to just like watch all of us work together. I'm just really excited for it. So thank you again for allowing me to present today.
And thank you for presenting. Very educational. And I've heard, the opioid epidemic explained many ways, but never losing, like a plane was crashing every day. And I think that was pretty impactful.
Definitely powerful. It's a good analogy.
Yes.
I heard that in a TED Talk, and I was like, yeah, man, it hit me in the gut.
Yeah.
It just hit me in the gut. And I was like, man, it's so real. Just makes it very real. So,
It does.
yeah.
All right, so thank you, everybody. Golf clap that you have your video on. And we are moving on in the agenda, but I did want to say we do have some speaker slots open this year. So if you have if there's somebody here that wants to speak, reach out to me or Kelly. We have the Kelly will put our information in the chat box, or I will when I'm done.
No, I will. That's fine.
Making a good team here. We're getting used to this a little bit. And I can't wear my contacts this week, so I'm sorry if I'm squinting and looking back and forth a lot today. So anyways, we're going to go on to committee updates and oh no, we're not. We're going to pill prevention. Sorry. So we have our first fundraiser coming up in April, and Eve Hosley Moore is going to speak about what that means and what you can do to help support it.
Thanks, Chrissy. I know, it's so exciting. We're just about 2 weeks away. Can you guys all hear me? Okay, good. I'm like so excited about this. So just to give you a little kind of update here, this is, like Chrissy said, our first ever fundraising event. And last year, our 10-year grant that really kept us afloat expired. And we became a nonprofit, and we're really doing a lot of work to stay sustainable. And this is like our very first real effort to bring in some dollars. So the event is on Saturday, April 10th. Let me share. You know what I'm going to do? I have some videos, and I'll start with this, and maybe this will kind of start it off. This is such a great TikTok by Sandy, who's on our chat team, and it's kind of answers a lot of questions. So let me just start by playing this. Can you guys see that?
Yep.
Okay, good. Let's make sure you can hear it.
Hey, did you know that Pedal for Prevention is coming up on April 10th at Starkey Park? But how much does it cost? Adults are $25 and kids are free. Do you have to ride a bike? Because I don't have a bike. No way. You can roller skate, you can run, you can jog, you can even bring your dog and walk your pet. What if I just want to walk? Of course you can. Just show up and have some fun. What time should I go there for the event? Hey, it starts at 9 and it goes until 12, but you can come by any time. Where can I sign up? You can go to our Eventbrite link here and look for Pedals for Prevention, just like this. Or you can go for the Alliance for Substance Addiction and Prevention Facebook page and get all the information there.
So that is so great. Great job, Sandy. Every time I watch it, I get all excited because it's just so cute.
Quickly, I'm going to put the actual website in because she put the old website in. So I'm going to make sure that's all right. She did a great job.
Okay. I actually didn't even notice that. So there you go. So it's just, I think it really conveys the message of how fun we want this event to be, and just it's kind of like our first time getting back outside, maybe, you know, socially distanced. So we have different start times, and when you do register on the Eventbrite, you can start at 9, 10, or 11. So that way not everybody's hitting the trail all at once. We're starting at shelter 5, and that's where you come in, you get signed in, get your bracelet. It connects right to the trail. It'll be, you know, the whole trail is about 12 miles, so we're not asking that. We're going to go a little ways out, put a halfway point there, maybe about a mile, with some stuff to take selfies and some water. It'll be fun, and then, you know, families can turn around and come back, or of course they can go. You guys can go further if you'd like. I wanted to show another video, which is this is on our Facebook page, and this was done by Remax Advantage Realty Group, and her name is Jen Verge. So I thought this was a great video. Can you guys see that?
Yeah, it needs to be a little bigger. And Jen just went out and did this video. Like, it was amazing. This is a great example of how community partners, like, other than sponsorships, can help us out. Like, we didn't even know she was doing it. She used the old name, but I mean, again, amazing.
So let's see, let me enlarge.
Dust off that bike, lace up those shoes, and hit the pavement for a great cause. Join us and others in Pasco County's Starkey Wilderness Park on Saturday, April 10th at 9 a.m. to pedal for prevention. Enjoy the sights and sounds of the trail and help others at the same time. Hosted by the Pasco County Alliance for Substance Abuse Prevention, do good, feel good, and help someone get a second chance. Hope to see you there.
I just love it. I think it's so great. So right now, like, in order for social distancing, we only had 5 vendor spots, and they're all sold out. We're so grateful. And, you know, there's going to be some great tables there, but we wanted to make it available for other people to get their information out. So we created a pandemic package, which I think this is really cute. You can give us your stuff and we'll put it in our goodie bag to hand at the end of the event. When everyone's done riding, they'll come and collect a bag with a bunch of great information, you know, lots of giveaways, all kinds of stuff. And you can either give us your bag to hand out, or we can put your stuff in our bag. And though that is $50. And I have, let me share, we've got, here is the flyer. And so the registration, can you guys see that? Okay, good. So the registration's on Eventbrite. We have a Facebook page. It's $25 per adult and $27 on the day of the event. So you can contact me or Missy if you'd like to be a vendor, if you'd like to put your stuff in our goodie bags. Our event sponsors include the law offices of Lucas and Magazine, Trinity Church of Christ, Suncoast Roofing, Magellan Complete Care, Bay Care, Spring Gardens, Pasco County Health Department, and Associate Recovery Communities. We have Vampire Penguin will be there with their awesome snow. This is exciting for us. I don't know if you guys have tried it, but it is just like great. Like, they're in downtown Newport Richey on that new building on the side across from the bridge, like kind of that new building over there. And then after the event, Culver's is giving us a coupon to hand out to all of our participants. And, you know, you can go get lunch at Culver's and still give us 25% of the proceeds. So you just hand them the card. And we're also grateful to Premier and Simply Healthcare, Simply Healthcare Plan, sorry about that, as they have sponsored scholarship riders. So if you know someone who'd really like to participate in this, but don't have the $25, no worries, just reach out, and we do have some scholarships available. Anything else? Oh, and also, like we said, this is our very first fundraising event. So this, we hope to do more because we want to be around and continue to provide great services for all of our coalition members. and for, just to bring us all together. And so if you have any ideas about future events, we want to, be here. And, so if anyone has any suggestions, comments, anything like that, just go right on ahead.
Eve, do you have the smaller version of this flyer? Lauren wants to share it on social media and the PDF isn't shareable. I think you have a smaller version too, right?
I do. What I'll do is I'm going to put it, I have like a JPEG. So let me go ahead and put that in the chat. So let me do that right now. And where is it? Okay, here it is. All right, it's a JPEG, so that should go in there.
Yay.
I know. So also if you want to volunteer, come out for the day, bring your families, bring your friends. Even if you don't want to go for a ride, come out and have some vampire penguin snow, which is really a treat. It's like so great. Or eat at Culver's, anything. We just want you to participate and come and have a good time.
Thank you, Evie. Does anybody have any questions? You guys have been doing great work on that. I haven't attended even one meeting, and I'm excited to see all of those videos. I saw the one, but I hadn't seen Sandy's, so that was kind of fun.
Making the best out of a digital world. It's fun. I'm having fun with it. I know Eve is too.
That TikTok though, I mean, we do need our teens and tweens to kind of help us with that. That is like over my head for sure.
I was impressed. She's having a conversation with herself. I've always wondered how they do that.
No, I love
Anybody else with questions? All right. And Evie, did you have something else to say?
Nope, that's it. I can't think of anything else, but we're just so grateful for all the participation so far, and it should be a great fun day.
And really, if you guys, have any ideas for future fundraising or ways to help, let us know. We'll take all the suggestions. We're brand spanking new to this. It's very different for us to ask for money. I feel guilty sometimes, but I remember what one of our contractors says. I'm not asking for me. I'm asking for all the people whose voices are unheard, or the youth that we're gonna prevent from going down some of the, same paths that, well, at least I have, and that's priceless. So.
Yes.
Renee, exactly.
Good way to look at it. And I've never heard of vampire snow, so that was my question. So I'm guessing it's like.
It's like ice, like almost like Kona ice, but it's all the flavors, and they have a ton of different, I don't know, like Lucky Charms and like all different kinds of huge bowls. It's amazing. You're gonna love it.
It's very creamy, and like on another perk, you can get vampire snow there, penguin snow at the event. And then if you've ever had Culver's ice cream, you can go to Culver's and get the ice cream. It's like a win-win. Like, why not?
Right?
They're bringing fruit flavors too, though. Just saying.
So yummy.
We can get all sugared up after we ride our bikes or walk or run or walk our pets.
We'll also have water, just so you know.
Thank you to Spring Gardens. We will have water.
Thank you. Yeah, thank you for everybody that supported this, that is here today, and all of our sponsors, anybody that's participated in the planning meeting. It's been exciting to see it progress. So thank you, Evie, for presenting too.
Oh, thank you. Yay.
All right, we're going to move on in the agenda now. We are at the committee updates. And so we heard that we had a great prescription drug committee meeting that was a town hall this last month, and I'm going to turn it over to Parnia or Crystal. I know Parnia is here. There you go.
Hello. So yes, as Chrissy and Whitney mentioned, we had our very first informational virtual opioid town hall. It was a great turnout. We had about 150 registered. We had a panelist from Congressman Gus Bilirakis. We had a couple Baycare and PAR healthcare providers, the Pasco Sheriff's Office. We had our Stand Youth attend. We also talked about medication safety, the Good Samaritan Act. So yeah, it was a great event. Hopefully there will be many more to come. And if you're interested, our next committee meeting is April 19th April 6th at 3 o'clock.
Yep, and that committee meeting is now in partnership with the Pasco Sheriff's Office Opioid Task Force. So those kind of meet hand in hand now. I was going to say something else, but I forgot.
And the DEA Take Back is in April 24th, I believe.
Yes,
is any,
April 24th.
I don't know if the Sheriff's Office or anybody here.
Yeah, I reached out, but I haven't heard anything back. So yeah, if anybody knows which sheriff's offices are taking part in that and how we can help, please let us know.
Or police departments. So we'll be advertising that too. I just knew that that was coming up in April. But yeah, great job on the town hall. I heard all amazing things and looking forward to see where we take this next. Any questions? Okay, our next committee update is our Substance Exposed Newborn Committee, which is in collaboration with the Healthy Start Coalition. And Missy has our event coming up on your screen. So Missy, I'm turning this over to you. Maybe.
She's muted. You're muted, Missy.
Dang it! I was trying to be on task too. I was muted. Anyways, so our Hernando Sin is in partnership, or our Pasco Sin is in partnership with Hernando Sin. We've been working together on our second annual Education and Beyond. So for every Friday in April, we will be holding a series of workshops, and they start at 11. There is a registration fee, but some exciting news is we were going to already have CEUs. Now we are having CMEs. So for any doctors that these are very expensive, so this is at a cheaper rate. So we're really trying to get the word out now about this. I believe it was posted on our social media yesterday. We're going to have different topics. If you go to the website, you can see each one and read about our presenters. So this is really exciting. We're trying to get the word out, and basically we saw a big increase in substance exposed newborns and neonatal absentee opioid withdrawal babies in our NICUs since in the past year, and a lot of that I believe is looking to be due to the pandemic and our substance use in the community. So if anyone's interested, we're still looking, as far as I know, for town hall vendors. That's one of the things that we're encouraging other people or other community partners to come in and provide that information. So we're really excited about this, and if you guys have any questions, please reach out to myself or Chrissy Paris, and we will get you set up in the right direction. And we're excited about this and just want to see you there.
Hey, Missy, can you put that flyer in the chat? I just put the link to the registration site up where more information is.
Yep, I can do that.
Thank you.
Thank you, Missy. And we're also working on like getting resources on a paper. Linda, I know you're here with the, what are we calling that? Blanking on it all of a sudden. Should have written it down.
I couldn't get unmuted. Roadmap, right?
Roadmap. Thank you. A roadmap of resources to help women of childbearing age that are either pregnant or you know, need assistance either with family planning or their substance use disorder. So we're getting all of that together as well on like a one-pager. And we revived some of our old material that we came up with like 10 years ago, and are updating it. And we will have more resources out about substance exposed newborns coming. So we have a great series of speakers, and those CMEs are only $45, but you do have to be in attendance to share on social media and get the word out. Like we really want to target the healthcare workers here as our last push.
I totally forgot all that because I was too excited to talk about the others. So good job, Chrissy.
Well, that's what I'm here for, is to fill in some of the gaps, right?
I was like, oh yeah, and I was fixing to share it and I was like, oh yeah, I heard you talk and I was like, I guess I just forgot everything else.
Well, the big thing is what you did, so exciting.
I will say for that roadmap, the way that we've looked at SEN over the years is like progress in the thinking is amazing. You know, that just the changing some of that to non-stigmatic language, and I don't know, it makes me happy.
All right, I'm gonna try and share this in the chat now.
Thank you. Anybody else have any questions or comments? All right. Next up on our committee updates is our Alcohol Initiatives Committee, which is in partnership with MAD, and I know Bonnie's on and maybe Janine, so I'm turning this over to you.
Hello, good morning, good morning. Okay, yes, Alcohol Initiatives Committee is partnered with MAD. We also are partnered with Tobacco Free Florida. So next month is Alcohol Awareness Month, and to celebrate or bring that in, excuse me, the County Commission always supports us, and so as they have in prior years, will be presenting us with a proclamation on April 6th. And it looks like that is actually going to be in person at City Hall. And I don't know if we've got a time on that yet. Kelly, correct me if I'm wrong.
It's Newport Richey City Hall, not County Commission, why am I blanking? But it's at 7 p.m. Their normal meetings are at 7 p.m.
Okay, thank you, Kelly. All right, so yeah, City Hall, 7 p.m., April 6th, we will be getting a proclamation. So if you feel so inclined to join us, please do so. We have been really pounding the pavement, completing our environmental scans. And yeah, we explained what those were. This is where we go out and we make sure that retailers are in compliance. So our next project for the committee is working on what we're going to be doing with that data, as well as getting our youth involved with the Sticker Shock campaign. So more to follow. That is just getting off the, once you finish one thing, it's on to the next. So as you know, when we did our updates last month, we talked about our excitement about having our best practices flyer completed. Now, like I said, it's on to the next stuff. Our Prom Promise event is still up in the air. We're still working on that. And if you want to join us, because we are an awesome group to hang out with, our next Alcohol Initiatives /MAD/Tobacco Free Florida meeting is on April 5th at 4:30. And that's all I have.
Thank you, Bonnie. They also got awarded a pot of money to do an alcohol town hall. Wow, I'm blanking on a lot of words this morning.
How can I forget that?
So congratulations on that, and we'll be working on that moving forward.
Yep, $750. How could I forget that?
Any questions for the Alcohol Initiatives Committee? Comments? All right.
All the meeting dates are on the agenda as well that I uploaded into the chat. So if you missed the meeting date, it's on the agenda and on our website under events.
And if you can't make the meetings, this is time, we use this meeting time to, that's really where the rubber meets the road, is at our committee meetings, but this is your time to give them feedback if you can't make those meetings or thoughts. So feel free to share thoughts with us now in the chat or later if you think of something after you've heard these updates. Tobacco Free Florida, Andrea?
Hello. I don't have too many updates. We did do a cleanup this past weekend. Bonnie was there, so was Sharon and Evie. So shout out to them. They brought some stand youth. It was a good time. We also are almost finished with our scans, which Alcohol Initiatives has helped us tremendously on. Thank you again, Bonnie. Shout out. We have about 10 more left, but I think not even that because Bonnie did a bunch yesterday for us. So thank you, Bonnie. And then I was told I can talk a little bit more about it. So some of you don't know, but we actually lost our grant. So that's still kind of up in the air. We're just finishing out the year and seeing where to go from there. That's really it.
Thanks, Andrea. Sad news about the grant for the Department of Health, because you guys have been doing such great work and we love working with you.
Well, thank you. We love working with you.
Any questions for Tobacco Free Florida? Just we joined forces with ASAP, but they are housed under the Department of Health. So I wanted to make sure that that was clear. We always put who we're collaborating with in there. Okay, just making sure nobody had any comments. Recovery Committee is next, and Rachel or Eve?
I don't think Rachel's on, so Eve, if you want to update.
Oh, I was just looking for. Okay, sure. We met last night. We meet the Monday before the ASAP meeting. We meet at 5 o'clock from 5 to 6. And we had some good speakers last night. In addition, we're working on creating a walk in September or some type of awareness raising event for National Recovery Month. So that's what's really, we're looking forward to that. We might do some event in July over the summer. We're waiting to see what the COVID numbers do and how things are going this summer, but we, really want to get together in person, how it all is. And yeah, so if anyone would like, we're going to need a lot of help with this event in September. So if anyone would like to participate, right now we're looking for a location and we're open to lots of ideas. So if you have any thoughts, just reach out. Anything else to add, Kelly?
Yeah, we also kind of started the discussion yesterday about how to better support people in recovery that also work in the field. Specifically, I mean, not necessarily only, but specifically peer specialists is a new position, and lots of feedback of burnout and not understanding, the organizations maybe not understanding what their position is supposed to be and not feeling safe sharing in regular support meetings because they're viewed as, a leader in their community and might have people that they work with in the meetings. So we're kind of starting that conversation and working with CFBHN because they have some great peer support meetings and just seeing how we can better support them. Like I said, it's a new position in the last 2 years, and I think everybody's kind of figuring out what the expectations are and what the job actually entails, which might be different based on organization. But we started talking about that, and we had, I cannot remember who it was, the Jennifer Webb from Project Opioid on last night, and she actually worked on the legislation for peer specialists, so she was a great help in getting us some ideas going on how we can move forward with that.
Great updates. Any other comments or questions from anybody? All right. Now we'll go to Stand Above the Influence. This is our youth coalition, and Bonnie is going to speak about their progress.
Okay, so like Andrea mentioned, we participated in the coastal cleanup this past Saturday. The Tobacco Free has adopted the stretch of road on the Sears side of Gulfview Square Mall, and so we go out once a year. Here you go, Kelly Potter, to clean up that side of the road, and our stand youth always go out and help out with that with that cleanup. Myself, the other STAND mentors, Evie and Sharon, went out. It's always a good time had for all. It's like, if you don't think you can have fun picking up trash, you haven't joined us. So we had our last, our youth led the year first STAND General Coalition meeting, where they wrote the agenda, they led the whole meeting, and of course they did amazing. So it's always a pleasure for those of us who are adults to continue to support them. And they're our future leaders, and their voices are oftentimes, depending upon the subject, more powerful than ours. We are working on a teen talk column for our newsletter. And this is where we're giving the youth an opportunity to write an article that's addressed to parents and adults, basically for them to educate us on not only issues that are important to them or that affect them, but also as a way to say, and oh, by the way, parents, adults, here's how you can help us. So that's, again, still in its infancy. That was just kind of brought up as an idea among our newsletter committee. But of course, once that gets, really excited to see that up and going. The next STAND General Coalition meeting is April 20th. We usually start logging on at about 4:30. The meeting itself really, kicks off at about 4:45. That extra 15 minutes that we do beforehand is just, an opportunity to get the youth on, making sure that, everything is up and working, kind of like a mini pre-meeting before the actual meeting. And as always, we are always looking for youth to recruit for STAND. We're also looking for, mentors, and, if you have any ideas, or if you know of a youth group that would be a good fit for STAND, please reach out to any of us mentors. Myself, Evie, Sharon, or Kelly. And that's all I have for STAND.
Yeah, so
something to add. I just want to say that STAND presented yesterday when they had their day off of school to the Pasco County, an audience of Pasco County school social workers, school nurses, counselors, school psychologists. And so they gave a little presentation about STAND and what the issues they're facing in school. So really represented the youth. I just wanted to throw that in there.
And one of our STAND youth was on the opioid town hall, and Gus Bilirakis offered her an internship, which was pretty amazing in DC. Like that doesn't happen. Like that was amazing. So that just speaks to some of the work that STAND is doing. So reaching youth during this, quarantine time has not been without its challenges. So if you, like Bonnie said, know of any youth or know of anywhere that groups should get started, we're all virtual right now. Please reach out to Evie or Bonnie or myself, and we'll be glad to help get them involved.
I'm always excited about that committee because of the youth, keeping and engaging the youth, and you guys have been really great with being innovative this year, so good job. Any questions or comments about STAND? All right, we're going to move on to cultural competence, and I'm going to turn this back over to Parnia.
Hello again. So since we finished our guidebook, we met last week to kind of talk about what our next steps are. So we're talking about creating a community survey. We're talking about possibly partnering with the Department of Health and getting into their community health needs assessment and doing the survey more on a regional level. So right now we're in the beginning stages trying to see what questions we want to ask, who our target audience is. So hopefully that'll be a cool regional survey coming out soon. And our next meeting is going to be April 19th at 3:30.
Awesome. Are they still on Mondays? Yeah, we still have those, right? Okay, great. Any questions for Parnia or cultural competence? All right. Well, those are our committee updates. We have a lot going on, clearly. I'm going to follow up just before I open it up to everybody else, is that we still do have timer caps, which go on standard size prescription bottles and say how long since it's last been opened. It helps with diversion. It also helps with forgetting if you already opened that or not. So if you have a population that could use those timer caps, we do have them for free to give to our community to help prevent diversion. And then we also have the doTERRA bags. So if people are not going to the sites at the sheriff's office or police departments to dispose of unused medications, we have the doTERRA bags, which will also be pushing during April and the DEA drug drop. So you can clean out your medicine cabinets for the 24th or ask us for a doTERRA bag and we'll get those to you. So that being said, now it's up to you guys to continue this meeting. What do you have going on that you want everybody on this call to know? You can put it in the chat, or you can just unmute yourself and we will try to wrangle everybody in and give everybody a chance to talk. Don't everybody talk.
Wow, really?
Hey, Chrissy.
Tamisa.
Oh, go ahead.
Yeah, this is Tamisa Williams, Department of Children and Families. A brief updates. I don't know, actually, I was in the last ASAP, so I probably mentioned it then. The most recent update is the My Florida, My Families website, which you for the last 10 months have heard about, I'm sure. It has been merged into our Access portal system. So I'm hearing about a number of different programs, especially the brick and mortar information, where I would call you all to go check it out, make sure your information is showing, because there is referral systems, a way to connect people to your resources, which I hear many of you sharing. The only other things is for the month of March, the food assistance SNAP program has been extended to give families the max amount, as well as they are currently waiving the work registration requirements for individuals 18 through 49. Starting April, there is the child abuse prevention kickoff. So we'll be reaching out. There are the pinwheels for prevention. So they're the blue pinwheels. I'm sure you all probably are familiar with it, where it's just a beautiful idea and thinking about the freedom of a child and how we are all in debt to protect our children and prevent any type of abuse. So I love the idea and was introduced with what the symbolism of the pinwheels and the mind of a child and that freedom we all were born with. And again, we're in debt to prevent any type of abuse to them. So I will include that information as well as my email address, which I believe was in the comments, but it probably was up. For any of your information, I do share it, especially with ASAP, a lot of the materials and the events that you have going on for April. I have been sharing them. I would suggest that you all save my email. If you have information or if you just want to be on my mailer, I have no problem with adding you all and getting information out to you. And I am putting this information that I shared in the comments.
Thank you, Tamisa.
This is Ashley at Turning Point of Tampa. I have a couple things. So on April 7th, I think that's the date, our next episode of our podcast will air, and we will be having Tina Levine on the podcast. So she'll be talking about just herself and also the Victory High School. So that will be available on the 7th. We already recorded with her. She's pretty awesome, as I'm sure everybody knows and agrees. Also, so in the state of Florida, we are trying to get together a state advocacy alliance. I'm trying to put together some of the details right now. We're hoping to have a meeting. I think it's on that same day. that Tina's episode will air. It's going to be done virtually, and this is a statewide alliance. So our goal will be to have a Hill Day in Tallahassee, probably in 2022. Really going to be focusing on, at the moment, addiction treatment. I don't know that some other things will not trickle in as well, like prevention. There hopefully will be stakeholders from all over the state. I have passed on a little bit of the information to ASAP and also neighboring Hillsborough County's coalition, HCADA. So once I have the information, I'll make sure to get it over to the powers that be at ASAP so they can share that. The first meeting will just be an informational meeting to see who wants to get involved. And I think that's it. Thank you.
And I think, just to go off that note that Ashley said, I'm pretty sure Victory now has a start date in April. I don't think Tina's on, but I think they're starting classes. So yeah. And I like being called the powers that be, by the way, Ashley.
Going off the chat, Jemima, do you want to talk about National Poison Week?
Yes, this is, good morning, everyone. Sorry, I'm on the call also. This week we're celebrating National Poison Prevention Week. And as you know, Prevention Week encompasses everything, whether it's substance abuse to just regular medication safety to plant or any chemical safety. So we just want people wherever you work to think of things that can be a poison and remind people that it's preventable. So whether it's to store their medications higher up, or you know somebody who has a substance use disorder, to provide them the resources that they need and to kind of work with them to make sure they don't relapse. And while they do receive treatments, so those medications also pose a risk for young children, because children get into whatever is in their environment. So if their parents are using substances, so that's what they're gonna get into. So just to remind people and people we serve that those things that can harm them can also be prevented if adults take responsibility, store things higher up. We have a lot of virtual events on our Facebook page. So if you need materials or any type of educational events, let me know. We can arrange that for you. And everything the Poison Center does, it's free of charge.
Excellent, thank you. Also in chats, Renee's been talking about the PACE Center for Girls fundraiser. Do you want to talk, Renee? I know you had to jump in and out today. All right, so there's fundraiser information in the chat box that Kelly may be able to read off since I don't have my contacts in there. And then Dave, you want to talk about teen foster homes? Well, then we'll come back to that one.
Okay. Oh, you want me to go? Oh, okay.
Kelly, Kelly, go ahead and do what you got to do. I'll jump in after.
Okay, well, I'm looking for it. So PACE Center for Girls has a fundraiser at Top Golf on March 30th. I should know this because I'm going. I should know the date, but she put the event site link and the Facebook page. PACE Center for Girls is a school for girls in Pasco County. They do a lot of great work. So if you're interested in that, the link is in the chat.
All right, Dave, you're on.
Thanks, Chrissy. Yeah, I did put the information in the chat, but I guess just to reiterate, and I know I've said this time and time again, but in child welfare, these things change almost on a monthly basis. But at the present time, for some reason, we're having a large influx of teens that are coming into the system of care. They're being removed from their homes. Again, the majority of those removals are the result of domestic violence in the home, which is the result of substance abuse and substance exposure in the home. So we are making a concerted effort to try to find folks in the community that are willing to go through the training to become foster parents specifically for these teens. So beginning April 5th, every other month, ongoing. We'll be having an informational session. ASAP was great to push this out on their email site. We appreciate that very much. All I can say about it is that if anyone on this call right now or anyone beyond this call that can get information out to the community, we appreciate it. It's a great need. And on a good note, a really neat note, this month we've been kind of recognizing social workers all across the nation, really. But here in Pasco, Pinellas County, we are recognizing nearly 400 social workers today with goodie bags, gift bags, thank you notes, things like that for the work that they do. You don't realize how many folks we have working in the social work field in our two counties, but there's nearly 400 of them, and every day they put themselves out. They truly are, in a lot of ways, very much frontline workers. They're out in the, I'm doing a lot of my work virtually. These folks are face to face in really, kind of scary situations a lot of times. So we thank them very, very much. And that's it.
Thanks, Dave. And I'm glad you brought that up. This is National Social Workers Month aware. And so being aware of how many social workers are out there and saving lives, really, right? Thank you to all the social workers here on this call and for all of the ones that work with Eckerd and child welfare.
Thank you, Chrissy.
Art, I don't know if you want to talk about the Narcan giveaways and what kind of materials you could use. Is he still on?
He was.
All right, so Kelly, do you know when the Narcan giveaways are? I know they're at Calvary Chapel once a month, correct?
Yeah, I don't know the exact dates. I can look it up and put it in the chat, but Calvary Chapel, Recovery Epicenter goes to Calvary Chapel to provide.
Put it in the chat, just so you guys know.
Art says he doesn't have a mic, but it's the second Wednesday of each month. Art, do you have a time you can put in the chat for us?
10 to 12.
10 to 12.
There you go. And that is, the Narcan's provided by Recovery Epicenter, and they give it out at Calvary Chapel Worship Center off of, what road is that off of? Trouble Creek, I think. So yeah, if you need the address or anything, reach out and we can get that for you. I'm sure Art could too.
I'm taking pictures with my phone of the chat so I can blow it up and see, and I don't think I've missed anybody.
You haven't, and I got it. And I'm actually quite amazed with how many people's events I know on the back, like the back of my head. It's like a scary place back there.
Chrissy, I was just going to say that open access is still happening with Baycare Behavioral Health, adult and children from 8 to 2 p.m. on Mondays and Thursdays. And they're still doing virtual bios for the first appointment to get started with therapy. And then most of those are also digital or video.
Thanks, Missy. Anybody else with updates?
This is Jessica with the Healthy Start Coalition. I just wanted to remind you guys that our general membership meeting is on Thursday, and I will put my email in the chat box. If anyone would like the Zoom link information for that, you could just shoot me a quick email. We have some great speakers tomorrow, or Thursday, sorry.
We hope they're great. Missy and I are meeting tomorrow to finalize that presentation.
Awesome, we're excited.
We will have some data on substance exposed newborns for those that might be interested. Any other updates? All right, well, we can call this meeting closed. If you don't have anything else that you wanted to share with the membership. But I can be funny and I'll take a motion to adjourn.
Can I motion? I'll motion.
Motion. And everybody can leave. But we love seeing you here today. We have a great meeting set up for next month. I don't know that meeting.
Julia Pauls with In Recidivism Project is going to be presenting next month. I don't know the actual date by heart though.
27th of April, if I'm looking at my calendar right. So we hope to see all of you back next month. If you have any questions, comments, thought of something afterwards, feel free to reach out to any of us and keep the conversation going through our committees.
Thanks, Chrissy.
Thank you to the
Thank you,
powers that be.
everybody.
Have a great day.
Thank you.
Kelly, you're saving the chat.
Yeah.
I don't even trust
I'm
myself to save the chat.
glad you reminded me that because I would have logged off without it. Yep, I'm downloading it now.
How many people still on? I can't see for some reason.
I wanted to know if I could get Tamisa Williams' email. Does anybody have that contact information?
We do.
I put it the question in the chat, but it.
Patty, I can send it to you. This is Caitlin Steiner. I'll send it over.
Great. Thank you. Appreciate that. You guys have a great day.
You too, Patty.
Hey,
Always
and
good to
also,
hear from you.
If you find out that we're needed for the drug take back, let me know.
Okay, we will.
Okay. All right, guys. Later.
Bye, Patty.
Oh, okay, there it is. Awesome. It's saved. I'm gonna try to get this meeting. Oh, let me stop recording. Hold on.